And welcome to News 2 Listens. With the death over the weekend of Ralph Hoisington, our solicitor, to pancreatic cancer, we thought we'd kind of open some dialogue tonight about that. And Dr. Mark DeLegge has been good enough to join us. He's a gastroenterologist. And if you have a question or a comment, 216-4938. We'll get right to some of your phone calls. And Carolyn's with us first. Carolyn, go ahead.
Yes, what are the signs and symptoms of pancreatic CA?
Okay.
Yeah, that's the problem. Pancreatic cancer often doesn't really have a lot of symptoms until the disease is quite far into its stage. So some symptoms, though, can be loss of weight, abdominal pain that no one can figure out. Some people become what we call jaundiced. What that means is that their skin turns yellow. Perhaps their urine may become very dark. Those are all signs that there may be something wrong. And
I'd always been under the impression that that coloring was as much a liver function issue as opposed to a pancreas.
It is, but you know, the pancreas and the liver almost lie on top of each other.
I see.
They're very close in proximity, and sometimes diseases of the pancreas can actually affect how the liver's functioning and vice versa.
I see. Let's continue with more calls. Peggy on the line with us from Somerville. Go ahead. Go ahead, Peggy. All right, we'll get back with her in just a second. The diagnosis in Mr. Hoisington's case was like December, and we always hear that it's a very aggressive and fast-moving, and you mentioned even a moment ago that by the time you know you have it, it could already be kind of advanced. I think that's what kind of everybody kind of said, well, he just found out a few months ago, huh?
Sure. You know, and this is one of those diseases that's very virulent. What I mean by that is that it's rapid moving. Unfortunately, again, by the time that you make the diagnosis, often it's well on its way. And unfortunately, the treatments that we have for it today still are not very good.
I see.
If you could receive surgery and be curative, meaning to remove the cancer part, that's fantastic. But short of that, our ability to deliver chemotherapy and radiation therapy is okay.
All right. Let's continue with more calls. Wendy on the line with us from West Ashley. Go ahead.
Hi. I would like to ask the doctor whether reoccurring bouts of pancreatitis are going to predispose someone to having CA of the pancreas.
Yeah, that's a great question about reoccurring bouts of pancreatitis, and the fact is that more inflammation in the pancreas, meaning that the more times the pancreas becomes inflamed, kind of like hitting your thumb with a hammer every month and having your thumb become inflamed, the more likely you are to develop cancer of the pancreas. And when we look at those statistics, people who have recurrent pancreatitis over and over have about a 2 times the risk as anyone else for getting pancreatic cancer.
All right. Try to sneak one more call. Pam from North Charleston with us next. Go ahead. Hi, Pam. You with us? All right. We'll try to get one more caller on if we have time remaining. But in the meantime, let me just... we have one more call? Yeah, go ahead. Caller, you with us?
Yes.
Yes, go ahead.
Okay, I would like to know if you had a TB sign test of 25 centimeters and 20 years later you haven't had TB, are you a carrier? Can somebody get this from you?
Is that in your area of...
Yeah, I mean, it kind of is. TB testing generally means that you've had some exposure in the past, but, you know, with TB, it doesn't mean that you're a carrier by any means.
In general terms, 50 and over, a time you need to kind of be thinking about checkups and the weight loss you mentioned, the jaundicing. I know in Carolyn's report earlier, males, but also African-American males seem to have even a higher predisposition.
That's absolutely right. You know, once you get older, like anything else, especially over the age of 50, there's a very linear increase in getting pancreatic cancer, more so at 60, more so at 70, and so on.
Right.
So, you know, as you get older, and especially over the age of 50, these are the types of things, the symptoms that you might have said before, I'm not going to worry about that, are the exact symptoms you should be checking with your physician.
Very well. Dr. Mark DeLegge, our guest tonight, we thank you for your expertise. It's good to have you with us tonight. We thank you for your calls as well. I hope you'll stick around with us. We have more coming back in just a couple minutes.